Good morning and Happy New Year, everyone. I'm Julianne, one of MHC's Public Health Committee Directors. Thank you all for joining us for our first health education webinar of the year, which is a collaborative partnership between MHC and South of Market Community Action Network, also known as SOMCAN. We have a lot in store for you today, so we'll just go over the agenda. We'll have an introduction from UCSF and San Francisco General ED physicians who are here, who kindly reached out to MHC to aid in supporting and educating you, our community, during this time. We'll then have a COVID-19 vaccine update by Carissa, one of our public health directors. And then we'll have a presentation from public health on safe exercise during the COVID-19 pandemic. After that, we'll have a behavioral health presentation on coping mechanisms in Filipino culture. Following these presentations, we'll start a new stream and we'll have pre-recorded Tagalog presentations available to those who speak Tagalog. And if you would like to watch these presentations in Tagalog right now, feel free to leave a comment or send a message to our Facebook Messenger so we can get you a link to watch in Tagalog right now. So just some quick tutorials before we start. If you're on a laptop or desktop and you want to ask any questions, just type your question here and hit answer and return on your keyboard. If you're on a smartphone, you also would type your question in the comment area and tap that blue button to send your question. We'll also be using QR codes during this presentation to make accessibility to links easier. So if you see a code and want to fill out our survey, you will just point your camera at the QR code and click on the link that pops up above. So yeah, we ask you to participate in our polls today. We're going to have interactive questions throughout the stream. All you'll have to do is submit your answer in the comments. And each answer will equal one raffle entry, and we have some goods to give away today. So without further ado, I'm going to introduce the physicians from UCSF at SF General Emergency Medicine will be introducing themselves. The floor is yours.
Hi, everyone. I'm Dr. Santa Marina. I'm one of the emergency medicine doctors. We're from UCSF and San Francisco General. I'll have my colleagues introduce themselves afterwards. Just wanted to say that we are here because we want to find ways to support you all in making the best decisions for you, your loved ones, and your community, especially during this pandemic. We will be collaborating with local Filipino groups for another virtual event to answer COVID vaccine questions in the near future, and we will let you know details when we have them. Thank you for having us. And just to say this in Tagalog, magandang umaga po sa inyong lahat. Gusto lang po namin magpakilala. Kami po yung mga doktor galing sa Emergency Department ng UCSF at San Francisco General Hospital. Narito po kami ngayon dahil nais naming makahanap ng mga paraan upang masuportahan kayong lahat sa paggawa ng pinakamahusay na desisyon para sa inyo, sa inyong mga minamahal at sa inyong pamayanan, lalo na habang tayo ay nasa gitna ng isang pandemya. Makikipagtulungan kami kasama ng mga iba-ibang grupo ng mga Pilipino dito sa San Francisco at Bay Area para maagawa ng isa pang virtual na kaganapan para masagot ang inyong mga tanong tungkol sa COVID vaccine. Ibibigay namin sa inyo ang mga detalye kapag naasikaso na. Salamat po sa pagbigay sa amin ng inyong oras.
Thanks, JL. I'm Dr. Mickey Gonzalez, and I'm happy to be here today. Also excited to learn about what you guys, how we can help you. Going further, I would love to be more involved in terms of like helping out with the clinic and whatever the community needs. I'm from San Francisco, and I feel very connected to this community, and I was excited to hear about being able to be a part of this.
And my name is Dr. Amelia Breyer. I just wanted to express gratitude for being here today and show my support however I can for this community. So thank you.
Thank you so much, Dr. Breyer, Dr. Gonzalez, and Dr. Santamarina. We look forward to working with you in the future. So if you have any questions for these physicians or about COVID-19, we want to hear from you. We have a survey available that you all can fill out to just hear your needs and what type of education you want to receive about the vaccine or COVID, etc. And without further ado, we're going to move on to the COVID-19 vaccines update by my co-public health director, Carissa Feliciano.
Hi, everyone. Good morning. Thank you, Julianne, for the introduction, and thank you to our doctors from UCSF and San Francisco General Hospital for introducing themselves. Today, I will be talking and giving an update about the state of the COVID-19 pandemic. I will be focusing on the COVID-19 vaccine, a little brief review of the testing sites that are available in San Francisco, and I'll be talking a little bit about the updated guidelines in regards to the new Stay Safer at Home order. So there has been a lot of talk about the COVID-19 vaccine recently. Right now, there are 2 COVID-19 vaccines that are authorized for emergency use. These are the Pfizer COVID-19 vaccine and the Moderna COVID-19 vaccine. Both of these vaccines are mRNA vaccines. They both require 2 shots. Pfizer's vaccine is 21 days apart, and Moderna's vaccine is 28 days apart. Both of these vaccines have shown over 94% efficiency at preventing COVID-19. And this is 7 days after the second dose. So your immunity towards the coronavirus doesn't kick in until you get that second shot. So how does this vaccine work? I know a lot of you may not be familiar with the term mRNA. What is it? And what exactly is the spike protein that this vaccine is encoding? So in order to develop this vaccine, scientists first discovered the genetic sequence of the spike protein. The spike protein depicted here in red is the protein on the coronavirus that helps it bind to and enter our cells. And they use this genetic sequence to develop or to create spike protein mRNA. And mRNA depicted here in yellow are basically genetic instructions which tell our cells how to make the spike protein. This mRNA is packaged in what they call a lipid nanoparticle. Basically, this is just a coating that helps the mRNA enter our cells. And this mRNA is what is in the vaccine and is what is injected into our arm. So once the mRNA is in our system, this mRNA will enter our cells. The cells will use this mRNA or these genetic instructions to create the spike protein. Once the spike protein is produced inside our cells display it on the outside of our cells. Once it's on the outside, our immune system realizes that the spike protein is not a protein that's normally in our body. It's a foreign protein. And this alerts our immune system to start developing an attack against the spike protein. Just as a side note, a lot of people are worried about the effects of the mRNA. And so once the mRNA is used to make the spike protein, it's actually broken down by our cells and discarded. So this mRNA does not affect your DNA whatsoever. It's just used to make the spike protein, and then it's degraded. So once the spike protein is displayed on the outside of your cells, our immune system starts to develop an attack against it. What this means is that we are building up our antibodies and our T cells, or our white blood cells. Our body produces these antibodies and activates our T cells or white blood cells in response to this spike protein. So in the case that the real coronavirus enters your body will be able to recognize the virus quickly and quickly start to build an attack against the virus. How this works is the antibodies that your body produces will bind to this spike protein. Here it's depicted in green. And so when the antibodies are binding to the spike protein, it prevents the spike protein from helping the coronavirus attach to our cells and enter our cells. So in essence, the antibody will kind of disable the coronavirus. The T cells that your body had activated will be able to recognize and kill any infected cells, any cells that already had the coronavirus enter them and is starting to reproduce the coronavirus. So our T cells or white blood cells will be able to kill those infected cells. Does anybody have any questions so far? I'm just going to go over a brief overview. So basically, the coronavirus vaccine, the COVID-19 vaccine, the Pfizer and Moderna vaccines are mRNA vaccines. Basically, they are these genetic instructions which tell our cells how to make this spike protein. Once the mRNA enters our cells, our cells use these instructions to produce the spike protein that is displayed on the outside of our cells. This alerts our immune system to start producing antibodies and activating our white blood cells to attack the spike protein. So in the case that the real coronavirus enters your body, you will be ready to fight it. Does anybody have any questions so far about how mRNA vaccines work? If you have any questions later on, you can go ahead and comment it in the comment section, and we'll be sure to respond. And we can also try to address your questions at the end of the live stream. So what are the side effects of this vaccine? The most common side effects are sore arm, so just pain, any pain at the site of where you got the shot. And there's some people also experience fever, chills, tiredness, and headache. And most of these symptoms are experienced after you receive your second dose. Most of the side effects experienced were mild to moderate. And these side effects may feel like the flu and even affect your ability to do daily activities, but they should go away in a few days. If you experience any flu-like symptoms, this is not the flu. It's just your body preparing and developing all of these antibodies and activating your white blood cells. It's just your immune system kicking into gear, and that's why you may experience these symptoms. So I know a lot of people have a lot of questions about the COVID-19 vaccine, so we're just going to go over some common questions. So why should I get the vaccine? It is really important for everyone to get, or most people to get the COVID-19 vaccine. It might prevent you from getting COVID in the future. And in the case that you do get COVID, the vaccine will prevent you from becoming seriously ill. Since your body will already be prepared to fight the virus, your symptoms will not be as severe if you end up getting COVID-19. So can I get COVID-19 from the vaccine? And the answer is no. There is no live virus in the vaccine. As we saw today, it's just the mRNA and it's not the actual virus. So you will not get COVID-19 from this vaccine. And lastly, can I stop wearing a mask if I get the vaccine? And the answer is not yet. It'll take a while for everyone to get the COVID-19 vaccine. So until the public health officials tell us, we will want to continue to social distance, wear a mask or face covering, and wash your hands frequently. And lastly, when can I get the COVID-19 vaccine? I'm sure a lot of us are eager to get the vaccines. And so the answer is the vaccine will be given in phases. We are currently in phase 1A. So the vaccine is currently being given to frontline healthcare workers and long-term care facility residents. After that, the next phase is phase 1B, and there's actually 2 tiers. So in tier 1, we have people 75 years and older, and then also certain essential workers that are highlighted here in yellow. Tier 2 of phase B will be those 65 years and older and other essential workers, and also incarcerated and homeless individuals. They expect phase B to start sometime in January. And phase 1C is people who are 50 to 64 years old and people 16 to 49 years old with underlying medical conditions, and then some other essential workers. Right now, it's unclear when the vaccine will be distributed to the general public or those outside of these phases. Right now, there is a limited quantity of the vaccine, so they're working on prioritizing who should get the vaccine first. Okay. And does anyone have any questions about the COVID-19 vaccine distribution? Okay. In terms of COVID-19 testing, you should get tested if you have symptoms or in close contact with someone who is COVID-19 positive or are an essential worker. If you have insurance, please be sure to contact your doctor or health provider first. There are free testing sites, but the testing sites have a limited number of tests and are currently very busy. So if you do have health insurance, it's best to go through your healthcare provider first. If you do not have health insurance, there are a lot of free testing sites available in San Francisco. So these are some of the main ones. The main ones you may have heard of are City Test SF or Color. And these test sites are available at Embarcadero and Alemany Farmers Market. Previously, there was a test site at SOMA, but that site has since been closed and was replaced with the Alemany Farmers Market site. There's also some tests available at City College through Optum. And there's also a company called Curative that hosts many test sites throughout the Bay Area. And for all of these, you will want to schedule the appointment ahead of time online. For Color, you can schedule a week in advance. And for Curative, you can schedule 3 days in advance. And we will provide these links here. So if you go ahead and take a picture or scan this barcode, it'll bring you to a site where we have all of the links to the COVID-19 testing sites and also some COVID-19 resources. And if you don't have an iPhone, this is the link right here that the barcode links you to. It's a link tree, so there's just a bunch of links on there that are really easy to just click on. And we can also post this link in the description of our Facebook post. Okay. Lastly, I'm going to go over some COVID-19 guidelines. Recently in December, the state and the region implemented the Stay Safer at Home order. So in this order, you should only gather with members of your household. You can actually meet with one other person who doesn't live with you, but they should be outside. and you should both wear mask coverings and still stay 6 feet apart. If you go outside, be sure to always stay 6 feet away from others and wear a face covering. And in this order, you can still go outside to exercise with members of your household. I recommend going on hikes, going on walks, or biking. And if you do go out to exercise, be sure to wear a mask if you are coming in close contact with other people. And lastly, in terms of quarantine guidelines, for those coming back to San Francisco from outside the Bay Area, you must quarantine for 10 days. This is just to prevent the spread of COVID-19. We don't want to bring in any virus from outside the Bay Area into the Bay Area. Okay. And so to wrap up this presentation, we're just going to have a question, and any entry, if you comment your answer below, this will be an entry into our raffle where we'll have some prizes that were provided by MHC and SOMCAN. So the question is, what is the Pfizer and Moderna COVID-19 vaccines, or what's in them? Is it live coronavirus? B, dead coronavirus, C, spike protein mRNA, or D, spike protein DNA? And I'll give you time to go ahead and comment your answers down below in the comment section. Okay, I see that people are commenting. I'll give you guys one more minute before we reveal the answer. Okay, and so what is in the Pfizer and Moderna COVID-19 vaccines? As we were talking about today, the answer is C, spike protein mRNA. So if you got that answer right, go ahead and pat yourselves on the back. But all answers will still be submitted into the raffle. So thank you to those who participated. And lastly, if you have any questions about this presentation, go ahead and comment down below. If we don't get to your answer right now, we will definitely reply to your comment and maybe address it at the end of our presentation. All right, thank you everyone for your time today. And I'll go ahead and introduce the next presentation, which will be given by our PH committee.
Hi, everyone. Good morning, and thank you for joining us today. Today, our Public Health Committee will be talking about safe exercise during the COVID-19 pandemic. So for me, I think it's really important to understand why we even exercise or do physical activity or promote physical activity in the first place. I know personally, I don't really want to work out if I don't know what it's going to do for me. So it's really good to understand why we are motivated to exercise. So here are the benefits of it. Some of the benefits include reduced risk of heart disease. So that includes things like hypertension and heart attack, stroke, type 2 diabetes, breast and colon colon cancer, depression, and reduces risk of other injuries. It'll also boost your immune system and reduce stress and anxiety. And I know that right now that's a really important thing with the pandemic going on. So we really want y'all to take that into mind. And it's a really healthy way to kind of cope with everything that's going on around you. And then lastly, or not lastly, but the last thing that we wanted to emphasize here is that it improves sleep quality and helps you sleep faster. So you don't need to take any sleeping supplements if you are regularly working out, and it should help you. The goals with this in terms of exercising is that you want to get at least or around 20 minutes a day, and that's really going to improve your cardiovascular health, so anything relating with your heart and circulation. And that's of moderate and intense workout, and we'll later explain how you can tell the difference between what a moderate or intense exercise is. And then the next thing is you can also do strength training, and we recommend that for 2 to 3 times a week, and that's going to help you with balance, bone health, controlling blood sugar, and your mobility. And now Katrina will talk about the data of how many people typically get their exercise, and we really want to raise that number for us to improve our own health.
Yes, so this data is from the CDC regarding physical activity from adults in the US. So according to the CDC, only about 53% of people met the physical activity guidelines for aerobic physical activity / cardio. And we'll kind of talk about what cardio is in the next couple slides. And furthermore, 23% of adults met the physical activity guidelines for both aerobic and muscle strength activities. And like Sam said, we encourage everyone to pursue exercise if they can, and we'll also give some examples later on.
Before we give out our examples, we want to tell you all about how to safely exercise both outdoors and indoors. So I'll start off with the outdoors portion. First, you want to check the air quality outside. I know this was a really big thing during the fall when we had the wildfires, but it's still important now because there's a lot of things in the air, and we want to make sure that we can try to minimize it. So the best time to exercise is during the earlier parts of the day, in the morning or during non-commuting hours, because you'll get less exposure to the cars and the trucks on the road, and that's really going to reduce the exposure to the air pollutants. And then the non-commuting hours are before 6 a.m., during 12 p.m. to 3 p.m., and then after 7 p.m. in the evening. A good way to check what the air quality is outside is actually just on your iPhone. On this weather app, you can see at the bottom, if you scroll, there's an air quality, and it'll show you exactly what it is. So it says 25 good. That's where I live, Antioch. So you can see exactly if you should work out then or not. And then on the next slide, if you don't have an iPhone, that's okay. If you have any sort of internet access, you can just search up air quality in blank and then provide the city that you live in, and they'll be able to give that to you. And so you want to work out between green or yellow, or from 0 to 100 for the air quality index, which is just the AQI. Just keep in mind though that if you're reaching 51 to 100, it's a little bit more it's going to be a little bit more sensitive for those with pre-existing conditions like asthma. So just like be careful with that when you are exercising if it does get to 51 to 100. The next tip that we have for exercising outdoors coincides with the previous tip, in which you should avoid busy roadways because that may lead to accidents, and so you should try to work out in open spaces, grassy areas, like a park or a trail. And then on the left is actually a photo of Yerba Buena Gardens, which is really close to Soma, and it's really pretty there too, and you can just take a really nice stroll there for about 20 minutes to 30 minutes, however long you want to. And then on the right is a link that we've provided that shows hiking trails by Soma as well. And so if you want to take a hike, there's a link right there that will show you that. And then lastly, I think the most important thing right now is that you should still wear a mask. Again, even if there is a vaccine out, that doesn't mean everyone has it yet. And so it's still important to wear a mask when you work out outside, and that can include either a cloth mask or a surgical mask. And then for the tips that we have indoors is that you should wear shoes when exercising, even if you are inside the house. I know a lot of time Filipinos don't really wear shoes inside the house. Like for me, I have pangbahay chinelas, and that's just like house shoes. But it's still really important to wear them, because if you are barefoot or if you just wear socks, that may cause slipping, and it might cause a lot of strain on your knees. So it's really going to help if you have shoes to reduce that stress and to give you traction. And then the last tip that I have for indoors is that you should try to use an exercise mat, or if you have hardwood and you're using a rug or a towel, really just to make sure that you aren't putting any strain on your back or minimizing the strain on your back. And so here are some examples of what an exercise mat looks like and what you can do with the towel if you're doing back exercises, or you can just lay the towel flat like the exercise mat. And then I'm going to pass it on to Micah for tips on how to work out safely indoors and outdoors.
Yeah, so some other considerations that's really important to take into account when you're exercising. Definitely stay hydrated before, during, and after the exercise. So make sure to have a glass of water or a water bottle near you while you're starting your exercise. It's really important to avoid slippery areas so you don't slip or hurt yourself. And you do not need any fancy equipment or even a large workout space to start. In fact, all you need are the right exercises for the space you have available and comfortable, breathable clothing to do all of your exercises. And lastly, one of the most important things to consider as well is to understand your physical limitations and don't strain yourself by doing too much. And so if you're experiencing a very high heart rate, nausea, or lightheadedness, it's important that you take a break and stop and rest before continuing. And there's actually a test that we will teach you in the next slide on how you can do that. And so that test is called the talk test. And as a rule of thumb, a person doing moderate intensity aerobic activity can talk, but they cannot sing during the activity. And a person doing vigorous intensity activity cannot say more than a few words without pausing for a breath. And so the idea behind this is that the more intense the workout, the more breathless you will be, and the harder it should be to talk. And so 2 ways you can do this. The first way is by reciting the Pledge of Allegiance, or really anything you want, and ask yourself if you can speak comfortably. And if yes, you're usually probably at low to moderate intensity. And if no, you're likely doing vigorous intensity activity. The second option would be to, before starting your workout, count as high as you can during an exhale. So for example, say if you count to 10, and then during your workout, count again during the exhale and compare the numbers. If the number counted during the exercise drops to about 70%, so this would mean dropping from like a 10 to 7, for example, that means you're doing moderate intensity exercise. And if it drops even lower than 7, then you're likely doing more vigorous intensity activities. And so some examples of different types of activities at the moderate and vigorous levels include brisk walking, water aerobics, cycling less than 10 miles per hour on flat terrain, playing tennis doubles, ballroom dancing, or general gardening. Whereas for vigorous intensity, this would include race walking, jogging or running, swimming laps, playing tennis singles, aerobic dancing such as Zumba, cycling greater than 10 miles per hour, that may include some hills and elevation, jumping rope, heavy gardening such as hole digging or hoeing, and lastly, hiking uphill with a heavy pack. And Katrina will also go into more of these activities in the next few slides.
Yes, so us, our public health committee wanted to recognize that we understand a lot of people think or have the conception that they have to change or compromise their workout routine because of the gym closures and the stay-at-home orders due to the pandemic. But we just really wanted to emphasize how easy and convenient it could actually be to work out at home. So here are some examples of moderate intensity exercises. One thing that's really easy and really fun, something that I like doing, is doing Zumba dances on YouTube. Usually they're follow along workout routines. So these burn about 600 to 1,000 calories in an hour. And like I said, it's really fun, so it's a great way to de-stress. It also improves coordination, And here are some examples of Filipino Zumba YouTube channels. So you can check out Live Love Party TV on YouTube, Simple Dance, Retro Groove Fitness. And if you're not really into dancing, you can check out YMCA 360 for a variety of different health and fitness videos. And later on, we'll have a slide with all these links written out for you. Another really fun and easy workout to do while at home is walking or hiking. So like Sam said, if you do choose to leave your house, remember to bring your masks just to stay safe. But walking or hiking can burn calories, lower blood sugar, ease joint pain, and boost your immune function. Oh, I accidentally clicked.
So some other strength training exercises that you can do at home are toe taps and heel raises. And so for toe taps, they work to strengthen your shins, and they are as exemplified by the woman on the right. So what you do is you have to sit in a chair while keeping your heels on the ground, lift your toes off the ground high enough so that the muscles of the shin are felt working. And you can check this by touching your shins and seeing if they're firm. And this exercise also helps in the blood circulation with the legs. And you can do 20 repetitions or more if you're comfortable, and you can do more than one set to rotate with some other exercises. Heel raises strengthen your upper calves, and to do this, you also just sit in a chair while keeping your toes and balls of the feet on the ground. Just lift your heels, just like the woman on the right, and you can do 20 repetitions or more if you're comfortable. Lastly, bridges are also something you can do. All you need for this is a mat or a towel, like we had shown you earlier. And this works to stretch and strengthen your lower back. So by taking a deep breath, tighten the buttocks and tilt the hips forward slightly, just like the woman and the man in the two animations on the right. Hold that position for a count of 3, and then tilt the hips back and hold for 3 seconds. And that is 1 repetition together. And so you can do 10 to 12 of those and multiple sets, and you can switch off between these exercises with the other ones as well.
So the last strength training exercise we have for you are wall push-ups and regular push-ups. So the wall push-ups are pictured on the top image. So you'll start off with standing around 3 feet away, facing a wall, with your feet kept at shoulder width. Then you'll lean forward and put the hands flat on the wall in line with your shoulders. The body will be in a plank position, so kind of flat, and the spine straight. You'll lower the body towards the wall, and then you'll push it back with your arms. This will strengthen your shoulder and chest, and you'll want to do 10 repetitions or whatever you can do. Remember not to strain yourself. Finally, we'll have the regular push-ups to increase your challenge. So you can start practicing by doing your wall push-ups a little bit lower, but on stable surfaces, and you'll eventually work towards doing push-ups off the ground, like the bottom image. And if ground push-ups are too hard while doing them on your feet, you could always do it with your knees, which is a modified version.
And then we just wanted to provide you a way to access these websites afterwards. So these are free websites that you can use. And we've made a link tree, and a link tree is basically just a website that takes you to multiple other websites on whatever you want to access. So ours is given right here. So it's just Linktree, but there's a period in there between. So don't forget that /MHC_PH. And this link tree has the YMCA link. And again, that's really good because if you don't want to dance, those are other guided exercises for y'all to do. And you can kind of look at it through ages. So if, and aim it towards your age specifically. There's a link on all of the Filipino Zumba channels that we provided. There's that link to the hiking spots that are near Soma. And then we've also added a 15-minute workout for older adults on there. And so that's a really good way to get in your exercise. Again, all the links include either cardio and or strength training exercise. To emphasize on that, cardio is anything like swimming, biking, running, and walking. And then strength training is really anything that aims to improve your strength. And you don't really have to have weights to do it, but it's really a cool thing to do. And you can like match it with your physical level at the moment. And then on the next slide are more takeaways on what we want to summarize and what we really want for y'all to stick what we really want to stick for y'all. And the first thing is that exercise has so many benefits. And so maybe if you're not looking to improve your sleeping, at least you're looking to improve like your cardio health or something like that, or cardiovascular health. For number 2 is you only really need about 20 minutes of exercise every day. Exercise is not as daunting as it seems to be. And so that goes on to point number 3. Exercise can be fun. And again, you don't need a lot of space. Some of the exercises we provided, like you just need a chair for it. So that's really cool. And then if you do wish to exercise outside, or if that's what you prefer, just please wear a mask if you do go outside, because that will really help you.
And here we have a poll question. So you could comment down below on the Facebook live stream what you think the answer is. It's pretty challenging, but the question is, all of these are benefits of exercise, except A, it improves the health of your dog, B, boosts your immune system, C, reduces your stress and anxiety, or D, reduces risk of heart disease, stroke, diabetes, cancer, depression, and injuries. I'll give everyone a couple seconds to fill out their answer. Okay, I see that the answers are coming in now. So the correct answer is actually, I'll give it a couple more seconds just in case. I see some people are holding up answers on the Zoom. Okay, so the correct answer is A. Unfortunately, exercise does not improve the health of your dog, but you could always take your dog out for a walk and improve the health of your dog if you want to do that.
Thank you, Katrina, for that poll question. It was really hard, so I don't know how you came up with that. We have our references here, and we just wanted to give a big shout out to UCSF's physical therapy department for helping us out with proofreading our slides and making sure we have all the correct information to give out to y'all. And then on the next slide, we just wanted to say thank you to everyone. And then if you had any questions, to let us know. We'd also like to give a special thank you to SOMCAN for collaborating with us today as well.
Thank you so much, Public Health. That was awesome. You gave a lot of tips on how to stay fit at home. We're going to transition into behavioral health. And one more thing, if y'all are watching this, please give us a like or a share so as many people can see this. So yeah, now transitioning to Gabe and Julie from our BH committee.
Good morning. My name is Gabriel Sumain Garcia. Okay. And my partner is Julie Calistone.
Oh,
And our presentation is on coping within Filipino culture. Next slide. Before we start, we're gonna do a really fast check-in. So what do you do when you're stressed or going through a difficult time?
Yeah, so you can comment down below in the Facebook comments, and you can just tell us what you do when you're stressed or going through a hard time. And we can just take a minute to wait on those responses.
You know, Julie, when I'm stressed or going through a difficult time, I really like to do small activities like, you know, simple things like going to the grocery store or singing anywhere, or like cooking a lot. What do you do to de-stress?
I really like going on walks. So like I try to like take time out of the day after I'm working to just like take a walk outside. I like put on a mask and like it's getting cold out, so I bundle up, but I just take a walk around my neighborhood and it's really nice being able to see people even if they're across the street. And so I see that some comments are coming in from our audiences. So one is I like to eat and surround myself with friends and family. I like doing that too. That's really cute. Mm-hmm.
Eating, always eating. So
I just love eating. Another one is exercise helps me a lot. I don't really feel that. It's hard for me to exercise, but I like
kind of feel it.
I kind of feel it with my, you know, my daily walk. Another one is someone likes to bake. So, you know, maybe stress baking or just baking. I like that. That sounds really good. Someone else said meditation. That's fun. Very relaxing. I love that too. Okay. So I think those are very good responses.
So now we're going to start with the presentation. So we asked this question because, you know, our presentation is about coping. So what is coping? Coping are actions often that we use in the face of stress and or trauma to help manage painful or difficult emotions. So basically, coping is our conscious effort to minimize, tolerate, and manage stress. Coping allows us to adjust to stressful events and helps us out with maintaining our emotional well-being. And I think you can kind of categorize like coping styles into two things. So like there's internal focus coping, which kind of refers to your own perception of, you know, the stress that you're experiencing and like how you go through it through optimistic thinking, goal changing, values restructuring, and meaning making. On the other hand, action focused coping refers to changing one's activities or daily routine to avoid or distance itself from the stressful thing. So this can be like, you know, going on a run every day to get your mind off of things. But now the question is, how do we cope as, you know, as Filipinos? So when we are stressed or experience difficult situation, how do we cope with them? In Filipino culture, there are many ways we cope, and one of them being our faith. Turning to our faith and accepting the reality of our situation makes us say phrases such as "bahala na" or "pinapasok ko sa Dios," to stay positive because, you know, we have a higher power with us and that we have someone we can rely on. And another way we cope with stress is by helping each other out, or pagkikikapwa, or bayanihan. Especially now with the current pandemic, our resilience as a community, as a family is stronger than ever before. And to cope with stress, we end up wanting to help others because, you know, it makes us feel good, it makes us whole, and it makes us feel like we're giving impact to our communities. And then another thing that we use to cope is sometimes we tell ourselves to tolerate the stress and to be flexible, or lakasan ng loob at pagtitiis. We always want to be courageous in the face of pain, and we try to tolerate it. We try to stay positive all the time, and we try to be, try to understand like ourselves more. And then lastly, sometimes, as Filipinos, we lessen our stress by relaxing or paglilibang, making ourselves happy by doing the things we like and feeling at ease even though we know it's a short time. So sometimes tatawanan natin ang mga problema natin. We use humor and creativity to facilitate life improvement after a very stressful life event. But is coping just all positive? Is too much positive when you're coping good for you? The resiliency of our culture is amazing, and we cope in different ways that praises us to always be happy. and to tolerate the pain we're in always, and to always try to stay positive. This happiness or saya that we're explicitly exuding to our peers doesn't necessarily mean we're happy. More so, I think it's an artificial happiness that we've made up for ourselves and to try to mask different types of emotions. But the problem with that is that even though we are trying our best to stay positive, sometimes the pain is just too hard, and the experiences that we have are just too hard to go through, and that like having a massive happiness doesn't actually help. And as a result, we turn to unhealthy ways of coping, such as suppression or pagkikimkim, at pagtitiis para makipagsama sa lahat, or to keep the group harmony. But with that, don't suppress your feelings. Be okay with sitting with your emotions, meaning be okay with feeling sad, angry, and really understand why you have these feelings. Because sometimes having a massive happiness and just deflecting all those other emotions and all those other feelings doesn't really help. And so like, just be okay with sitting with your emotions. And now I'm going to pass it on to Julie.
Okay. So, all right. So now that we know it's okay to express your emotions and not hide them, so whether you're feeling lonely, nervous, sad, or angry, emotion-focused coping skills can help you deal with your feelings in a healthy way. So healthy coping strategies may soothe you, temporarily distract you, or just help you tolerate your distress a little bit more. I know a lot of members in our community are frontline or healthcare workers, such as nurses, doctors, caregivers, etc. Because of the pandemic, things can be really stressful right now. So acknowledging your emotions throughout this time is a good first step with dealing with the stress of everyday life. So some examples of coping skills that help deal with emotions can be taking a bath or cooking a meal, as seen with the photo in the presentation. This can be an example of palilibang, one of the ways to cope, which we talked about earlier. So relaxation. You can also exercise, give yourself a pep talk, or meditate. I know for my family, we often cope with stress by exercising together. So that may mean, taking a hike or just going on a long walk around the neighborhood. One thing that we also do is we pray. So, which is also a form of meditation and an example of the spiritual way we cope as a community. However, I just wanted to note that while it would be important to use coping skills to relieve some of your distress, coping strategies shouldn't be about constantly distracting you from reality. So while it's good to kind of like lessen the stress and maybe change your emotion towards a certain thing, just as Gabe said, it's really important for us to acknowledge or just know about our emotions, kind of figure out why we're feeling this way towards either someone, something, or a certain situation, and kind of realize, okay, why am I feeling this way? And do I like it or do I not like it? And does it have to do with the situation that I'm in? Which brings us to our next topic, which is problem-based coping. So I understand that dealing with stress isn't just talking about our emotions or our feelings, but it's also realizing the environment that we live in. So problem-based coping is helpful when you need to change your situation or remove a stressful thing from your life. So this may mean changing your behavior or creating a plan that helps relieve stress or become happier. So I understand that while not all of us are frontline or healthcare workers, some of us may still work from home or just have a really busy family life. So trying to maintain a normal life during the pandemic can be really stressful too. So some examples of how to relieve this stress with problem-focused coping skills can be establishing healthy boundaries. So this may mean, taking a break. So maybe it's knowing when you need time alone from family, after work, or you just like after a long day of work, of school, of running errands, you just might need time to just relax and just take a deep breath and just, calm down. I know for me, my mom works overnight at the hospital. So she tells us not to bother her while she sleeps. But also at the same time, a way she relieves stress is by asking for support. So this can include therapy, you know, talking to a doctor, going to a mental health support group, but sometimes it's as easy as, you know, reaching out to your support system, so your friends and your family. So for me, my mom tells us to, you know, help around the house, maybe run errands, like go to the grocery store, pick up medication. But at the same time, it's just as simple as like gathering your friends, gathering your family in your support group, and maybe sitting on the couch, watching a movie, and just spending time together and relaxing. So this can be seen as examples of palilibang or, you know, bayanihan, and having that kapwa and having that time to relax and enjoy the time together as a family or as a community. But one thing is that sometimes, lastly, an easy way to cope with a problem or stress in your life is, but sometimes just as simply as putting yourself first. So I understand as a Filipino community, we often think about others first, and we often put others before ourselves. But whenever we're feeling stressed or, you know, a little frustrated, sometimes putting ourselves first and thinking of ourselves and our feelings and how we feel about the situation is a really good and healthy first step in figuring out, you know, what can I do to help improve my health or the way I feel about things. So that's one thing. So even though we talked about ways to cope with emotions and situations that affect us in everyday life, I just want y'all to know that there are many healthy ways to cope. So, you know, even though we talked about we gave all of these examples of like healthy ways to cope and how we cope as Filipinos, it's really up to you, the individual, to decide which coping skill is likely to work best for you and your situation. I know that everyone is going through different things. So there are going to be different solutions. So maybe for one person, they really like exercising, but you know, another person may not like exercising or have that ability. So they might, you know, meditate or pray some more, and that's totally okay. I just want to reiterate that there are many healthy ways to cope, and it's different for everyone. But as long as we're taking that first step to create these healthy habits, I think will grow better, not only as an individual, but as a community. So I'm going to pass the mic on to Gabe.
And so now to just reiterate what Julie was saying, we have a little quote. So, you know, we all have different ways of coping. And so learning more about each other and ourselves can foster a more healthy internal and external environment.
Mm-hmm. And so now we just want to leave you with this last question. It's also a poll question, but also a reflection question. So it's, what healthy habits can you use in the future? So it's just some things to think about as we're going into a new year. What healthy habits we may want to start, especially coping habits that we have within our community. So I know one is A, exercising, B, spending time with friends and family safely, C, meditation, or D, all of the above. So we'll just give a little minute for that. Gabe, what do you think you'll do in the new year? Just like, do you think you'll pick up a new habit or try something new?
I really want to learn how to bake, not gonna lie. Because I like cooking, but like baking is just like, you know, like I feel like cooking, it's like you just put stuff there, stuff here, stuff there, but baking is like so precise.
Mm-hmm.
I just like, I never followed the rules. So
Yeah, baking sounds like really good, also delicious. I feel like I want to try and cook more as well. Cooking is one of like the coping mechanisms that we have, because I feel like, what is it? It's good for me to, I don't want to spend more money eating out, and also it's good for me to just like nourish my body and take care of myself. A lot of people are commenting D, all of the above, which is great. I love that. I'm glad everyone wants to exercise and spend time with family and meditate. I feel like meditation, I haven't really tried meditation, just praying, but I feel like meditation like is very tricky for me. But
it's
yeah.
pretty nice. I like meditation.
Mm-hmm. Yeah. So since a lot of people are commenting D, that is the correct response. So congrats to everyone commenting D. I hope y'all actually pick up these healthy habits, or at least try to, as we go into the new year. All right, so moving forward. All right.
Thank you and Happy New Year.
Yes, thank you so much for joining our presentation. We really appreciate your time, and we hope y'all have a happy new year. So now we're gonna go pass it on to our directors.
And so now we're gonna go to the Tagalog version of this whole presentation.
Thank you so much, Gabe and Julie, for your awesome presentation and really making it culturally sensitive to our Filipino community. One second. Okay. Sorry about that, but we're done with all the presentations for the day, and then following this, we'll have the Tagalog stream, but we have a feedback survey available for you all. So again, you can scan the QR code, and the survey is available at tinyurl.com/MHCSurveyJan. And completing the survey will equal 1 raffle entry. We really want to hear your feedback and really hear what you want to learn about from us. And then once again, we want to give a special shout out to the South of Market Community Action Network, SOMCAN, for partnering with us. We really appreciate the feedback and the support and help you've given us, and we're excited for the future months of this partnership. You can find all their contact info below, and they should be tagged also in our description. So yeah, that concludes our presentations for the day. Thank you for joining us, and I really hope that you all just take care of yourselves. You can join us here on Facebook Live on the second Saturday of each month. And again, following this, we're going to have a stream of this month's presentations in Tagalog. So if you'd like to listen to our presentations in Tagalog, stay tuned and we'll be there for you. So thank you, everyone, and have a great day.